All right. We have a very full program, so I think we should get started. I'm just going to start the introductions. If people can come in and get seated. Our next session will address the issues of brain disorders, drugs, psychopathology, and violence. What are the links? This is going to be moderated by Dr. Jeffrey Swanson, professor in psychiatry and behavioral sciences at Duke University. The panelists for the session are Nellie Aaliyah Klein, professor of psychiatry at the Icahn School of Medicine at Mount Sinai, James Blair, chief of the section of affective cognitive neuroscience at the National Institutes of Mental Health, and we are very glad that he's able to be here today, that the government is back so he can join us. And Owen Jones, New York alumni, Chancellor's Professor of Law and Professor of Biological Sciences at Vanderbilt University, and Director of the MacArthur Foundation Research Network on Law and Neuroscience. Each speaker will deliver individual remarks. These talks will be followed by a panel discussion, and the floor will be open then for audience questions and participation. Please welcome our first speaker and session moderator, Dr. Jeffrey Swanson.
Good morning, everyone. Just about 4 weeks ago, all of us were absorbed in the news of yet another mass casualty shooting at the hands of yet another troubled young man. And as the details unfolded, the same conversations, the same unanswered questions collided again in the public square. Was this a story about untreated mental illness? Unheeded warning signs in a fragmented mental health care system? Was it a story about unregulated firearms? A failed background check in a system that's supposed to keep guns out of the hands of dangerous people? Was it scientifically predictable? And if it was, why didn't somebody do something? Well, you know, there's no short supply of pundits and experts out there who are perfectly willing to answer those questions for us, and I'll tell you how they do this. It's not that hard. You can do it too. All you need is this remarkable device called a RETROSPECT-O-SCOPE. It's just amazing what you can see through this thing. Now, the trouble starts when you flip it over and you try to point it out towards the future and see if you can predict and anticipate violence in people with mental illness, and when that happens, it all turns to fog, and even trained psychiatrists with structured risk assessment instruments is not much better than a coin toss when they try to predict violence in individual patients. Well, if it's that unpredictable, it makes you wonder. Does mental illness cause violence? And I can answer that for you. And the question is three questions. What do we mean by mental illness? Do we mean the major diagnosable psychiatric conditions that impair mood and perception of reality and thought, like schizophrenia and major depression and bipolar disorder? If we do, it's a pretty weak correlation. But maybe we mean this whole panoply of maladies of personality and behavior, from addiction to psychopathy, to explosive anger, to the psychological sequelae of trauma. And if that's what we mean, well, lots of people who are violent meet criteria for some kind of psychopathology. And, you know, we could even say in one sense that a violent act is pathological on its face. I mean, what person in their right mind would do something like this? But what do we mean by violence? Do we mean fistfights in a bar? Do we mean intimate partner violence in a domestic sphere? Do we mean a mass murder-suicide with a firearm? Maybe it's all of that, but maybe it's this big picture too, where we would include acts of aggression and violence. Some of them are socially sanctioned, culturally shaped, motivated by ideology and religion and politics. And what does that mean? You know, are there more similarities and differences across all of these kinds of violence? And finally, what do we mean by cause in the question, does mental illness cause violence? Maybe it's really straightforward like this. If mental illness at time 1, then violence at time 2. And if it's that, well, I don't think so, because there are too many people with serious mental illness who aren't violent and never are going to be violent, and there are too many people who are violent who just aren't mentally ill. But again, maybe it's this complex system, like these dominoes, where mental illness and violence are embedded in a complex causal system with all these upstream precursors and codeterminants from the social environment to genetics and all of these downstream intervening variables, mediators and moderators and interaction effects like substance abuse and access to lethal means and provocation. So it's complicated. Did you know that about 60% of the adults in the United States believe that people with schizophrenia are likely or very likely to be violent? If you came from outer space and you learned everything you knew about schizophrenia by watching television in this country, you'd think that every single person with schizophrenia was a homicidal monster. Well, why does that matter? It's important because public belief, this idea in the public mind, determines action. We act on the basis of what we believe to be true. And if we think people with mental illness are dangerous, we will fear them and we will reject them and we will support public policies that limit their liberty, whether those policies are effective and fair, and maybe they even drive people away from seeking the needed treatment that they otherwise would seek voluntarily. And there's a big disconnect because only about 12% of people with schizophrenia are violent, according to epidemiological studies, and that could be anything from pushing and shoving someone, hitting someone with a fist. If you want to talk about what people are really worried about, homicide against a stranger by someone in a psychotic episode, that's about 1 in 70,000 people with schizophrenia, so 69,999 will not do this. Substance abuse does increase violence. It can do that by exacerbating symptoms like excessive threat perception and anger. It can inhibit aggressive impulses. It can expose people to lots of influences in the social environment that increase violence. But if you factor out substance abuse, the absolute risk in people with just serious mental illness, schizophrenia, bipolar disorder, major depression is about 7%. Relative risk is about 3.5 to 1. The attributable risk is 4%. So if we magically cured all these miserable diseases tomorrow, that'd be a great thing, but our violence problem would only go down by about 4%, 96% of it would still be there. And as a matter of fact, people with serious mental illness are far more likely to be victims of violent crime than they are perpetrators. There are lots of people with criminal justice with mental illness in the criminal justice system, but they're not that violent either. Only about 11% of the arrests in a group of people with serious mental illness in the justice system were violent. The rest are minor offenses, like trespassing and so on. So where does that leave us with predicting mass shootings? Well, it's a needle in a haystack. Have you heard that? You can't predict it. You'll never find them. But guess what? The needle has found us. So let's pick it up. Let's look at it. Let's study it with our interdisciplinary lenses and see what we can learn. Let's try to find the haystack in the needle. Look at these characteristics and think what we could do. We could do a lot of things. We could get upstream to try to address the social determinants of violence, have fewer kids who are exposed to trauma, and grow up to be perpetrators. We could also do things like provide access to evidence-based treatment for people with serious mental illness and substance abuse. And we could do a far better job limiting access to lethal means for people when they're violent. What if we prohibited firearms from everybody with a history of violence, even if it's a minor a misdemeanor violent offense? I think if we did these things and other things, I think we would live in a less violent society. There's not going to be a headline tomorrow in the New York Times that says, better mental health care system prevents mayhem on Thursday, or improved background check system prevents mass shooting today. We wouldn't know that, but why would it matter? Thank you.